Today our group will be talking about clinical management of lateral epicondylitis. Our hypothetical patient is a 24-year-old female who has been diagnosed with left lateral epicondylitis, also known as tennis elbow. The patient states she works as a medical transcriptionist and is constantly at the computer and keyboarding. She used to work at the hospital, but now works from home to be with her 2-year-old child, and she admits that she does not have the ideal workstation set up. Pain is located along the lateral anterior aspect of her elbow and down into the wrist and fingers, and has become so intense she can barely pick up an empty mug of coffee, let alone type for any extended period of time. Her pain level is generally around 7 out of 10, but can get down to 5 out of 10 with rest. The patient has been taking pain medication and icing, but is not consistent with this. She reports the doctor did give her a wrist brace, but didn't put it on her or give her any clear instructions of how and when to wear it. Her medical history is unremarkable. She doesn't have any comorbidities or anything like that. Upon examination, the patient demonstrated severe to moderate tenderness upon palpation along the left lateral epicondyle and wrist extensor muscle group. Her active wrist flexion is 45 degrees with pain and pulling into the elbow and forearm. Her wrist extension is 60 degrees, also painful. And her ulnar and radial deviation are both within normal limits, as is pronation. Supination, however, is 45 degrees with pain. The patient has had pain with manual muscle test of wrist extension, supination, and gripping. Her grip strength averages 50 foot-pounds on the left and 80 foot-pounds on the right. The patient is right-hand dominant. It is also noted upon observation that the patient has moderately rounded shoulders and a forward head posture in both sitting and standing. Manual muscle test of her scapular muscles demonstrated 3 out of 5 strength bilaterally. At the initial evaluation, the PT started with phonophoresis for pain relief and instructed the patient to ice frequently. The PT also suggested the patient bring in the brace to her next visit so it can be fitted and she can be educated in its use. The patient was also instructed in self-range of motion for wrist and forearm within pain tolerance.
This is your brace that you've been given to wear, and this will limit your flexion and extension, and it'll also give your muscles a break so that you're not using them, and it also will support your muscles here while they're healing and the inflammation is going away. And but you want to make sure that you still have movement in your fingers and that your fingers are not going to be discolored, or if they become numb, then you need to loosen it. That means it's too tight here. Okay. Do you have any questions about this?
No. The next thing we're going to do is we're going to work on chin tucks. Okay, and I want you to put your hands on both sides of your face, and I want you to tuck your head in, kind of like if you're a turtle, you're going to tuck your head into the shell. Very good, you're doing a great job. And the next stretch we're going to do is we're going to work on a pec stretch. So because we want to open this up here to help you with your posture. Okay. So, and then I'm going to show you if you want to put your hands behind your head. And then I'm just going to pull back a little bit gently. Yep. Can you feel the stretch? Yep. All right. And again, you hold this for 30 seconds. Yep. But since we're going to be going home and I want you to do this at home, I'm going to show you a way that you can do it in a doorway, okay, at home. So if you follow me, and then lean into it, okay? Whichever one feels more comfortable. All right, should we give it a try? Can you feel the stretch? Mm-hmm. Yep. Do you want to try it the other way with your arm? Yeah. And you can kind of lean into it, and then you should feel the stretch in here. Mm-hmm. And then you can do that on both sides. Okay. Right. So we're going to show Amanda how to find her core, because this is going to be what will help with her posture. So what I want you to do, Amanda, is I want you to find your ASIS, and we're going to go in the middle right here. And then can you do that? I want you to feel this on yourself. Okay, and then I want you to tuck your belly button and pull it into the back of the table a little bit. And then just kind of tighten up your core. Mm-hmm. And if you have a hard time, you could maybe cough or something.
Can you feel that?
Yep.
Okay, so that's when your core is engaged.
Okay.
And then you also want to make sure that you're in neutral spine. So if you arch your back really far up, and then push it against the table, or against my hand. Okay. Now I want you to find that spot in between. Okay. Now that is neutral spine. So when you have your core engaged and your neutral spine, that means that your everything is lined up the way it should be.
All right, we're going to teach Amanda how to massage her arm. So we're going to have her work laterally and go all the way up her arm, and this will help with her pain and circulation. Okay, we're going to be working on active assist range of motion. So we're going to do extension. And what I want you to do is I want you to use your own muscles to try to get to that point. And then once you can't, then use your other hand to help you go the rest of the way. So you're going to go up as far as you can, and then use your other hand to help. Is that extension? Very good. Okay. Then you're going to do flexion, and you're going to go as far as you can, and then use your other hand to help with that range of motion. Okay. And then you're going to go into neutral, and you're going to go as far as you can, and you're going to bring your palm to the ceiling, so that would be supination, and then use your other hand to help you. Alright, and then for pronation, I think you can do that on your own, so I want you to be able to do that. And then for radial and ulnar deviation, I think you can do that on your own, just to make sure that you keep those motions. So I want you to be able to do that at home. Okay. So the next thing I want to do is we're going to work on your gripping since you have limited grip. So you're going to roll up a towel all the way, and then what I want you to do is hold on to it and grip it as hard as you can. And I want you to do that for about 10 seconds and 8 to 10 times, 2 sets, a couple times a day. So just try to grip it. Good job. And as your grip gets better and stronger, and after you've been doing these for a while, then you can just unroll your towel, and then your grip will be smaller. So then we're going to be able to try to do that. So, good job. And you know what, as you're doing this, I noticed your posture, and you're keeping in your core, right? Yep. Okay, you want to make sure you keep doing that. Good job.
So as we move more into the subacute phase, we are going to continue with the exercises from the acute phase. We're going to continue with the pec stretch. We're going to continue having the patient wearing her brace. We're going to continue with the massage. And we're going to start progressing to more of a friction massage, very, very gently along the lateral epicondyle. And as we progress through the phase, it's going to become with more force. And you also want to remember to remind your patient to use the ice massage after friction massage. We will progress our active assistive range of motion to more of an active range of motion, so you can see how the patient is doing and how where they are. And if they're able to lift their wrist up for extension all the way, and have them flip it over. And over supination, having to do the motion nice and smooth with full control. And then also remind them to continue with radial deviation and ulnar deviation along with pronation. We will also continue with stretches for the flexors, extensors, and supinators with very minimal pressure. And we're going to start progressing that to more of an overpressure to really start getting more of that stretch. And you can also continue to stretch the radial deviators, ulnar deviators, and pronators as well. So in our subacute phase, we're going to start with some strengthening exercises. A good one to start with for grip is to have a towel rolled out along a table, and you just have your patient start to scrunch up the towel with their weak hand. And you would have them do this about 8 to 12 times, which is actually the length of the towel. So 8 to 12, 2 to 3 times a day. And as the patient starts to progress with their strength, you can add a weight on the end of the towel to start giving some more resistance. And again, you would do this exercise 8 to 12 times with the weight up. So next we're going to start progressing more strengthening for the wrist flexors, extensors, and supinators. So you can start with your patient having a cuff weight, wrapping it around and having them put it over their hand, especially if their grip is not as strong as you would like it to be for them to grip onto a weight. So you can start by having them do 8 to 12 reps of flexion and extension. And you can also go right into supination as well with this. And as those muscles start to become stronger, you can take the cuff weight off. And as the grip becomes stronger as well, you can have them hold onto a hand weight and do the same exercises with that. And that's also working grip as well. So again, 8 to 12 times, 2 to 3 times a day. And another good way to progress the supination is to have them hold onto one of the ends of the dumbbell, and that's going to make a longer lever for the weight. So we're going to work on some scap stabilizations to help with the patient's posture. So what you can start is having the patient laying down in prone, and we're going to do some I's, T's, and Y's with the patient. So again, have them start in prone and have them put their hands to their side, and they're just going to lift their arms up for I's. And this is a good time to remind your patient about bringing in their core, finding the neutral pelvis before you start, and reminding them to breathe as they're doing the exercises. So after about 8 to 12 of those, you can have the patient bring their arms out to the side, and you can have them bend their elbows to start with, and bringing their elbows up. And as they get stronger, you can have them straighten out their elbows, which creates a longer lever. And then for the Y's, you're going to have them bring their arms up in front at an angle. And if this is difficult for the patient, you can have them start with one hand, and then go into the other one. And then as their strength progresses, you can have them do both at the same time. So we're going to progress from the prone position for the I's, T's, and Y's, which is just using gravity as a resistance, to standing and using a TheraBand as our resistance. So you can give your patient a TheraBand and have them wrap it around a nice steady surface, post, something that they can tie around at about chest height. And they're going to be doing the same motions for the I's, T's, and Y's, except hanging on to the TheraBand. So they're going to pull their arms back for I's. And again, you're going to want to remind your patient to bring in their core to stabilize their spine, and to remember to breathe as they're doing these exercises as well. And with this, they're really going to be feeling it in their lower tract.
All right, now we have reached the return to function phase, so we would continue to progress stabilization, reminders about postural awareness, keeping everything pulled in nice and aligned. So a good stabilization exercise for Amber in this phase would be, you could stand up for me, Amber. I'm just going to have you grab onto this just like this, and keep your elbows straight while you're doing that. And I would just add some perturbations going this way, that way, that way. And what this will do is help with the scapular stabilization, she's getting isometric work in her elbows and her wrists and working her grip as she's doing that. And then we could take it so she's holding it this way and still working on scapular stabilization from all directions. Remember to pull in your core and breathe, Amber, as we're doing these. Very nice. And as her grip is getting stronger, you can just use a smaller dowel for that so she has a smaller grip and just kind of go through the same type of thing, pulling in all the directions. You know, changing up the grip, she can do it that way, pronated, and turning it over, turning her wrists over so she's supinated and just doing that. Thank you, Amber. And for some of the functional activities, she's got a small child at home, so we look to the toy box for some inspiration. And work grip, go ahead and have a seat. We've got, what you'll find in some clinics is something called theraputty, which can be used for gripping strength just by squeezing. We're using Play-Doh, which is a nice affordable alternative, and if she's got a 2-year-old at home, very likely has that, because it always makes its way into small children's homes. So I'm going to give you that, and you just want to squeeze and just, yeah, roll it out. And there's all kinds of things she can do with this, mainly the squeezing for the grip. You can kind of work on rolling it out, and that works her hands in all various directions that way. You can do precision stuff. How's that feel, Amber?
Good.
All right. So, that one. And for working the finger extensors, wrist extensors to a certain degree, just to keep everything isometrically working, you can use a rubber band around the fingers and opening and closing with a controlled motion to work the muscles eccentrically as well. So, let me give that a shot, Amber. And nice and controlled on the way back. How's that feel?
It feels good.
And just like the other exercises, you're still doing the 8 to 10 reps, a couple of sets with that. All right. And work precision grip, peg puzzles. And I won't make you do the whole outfit. Okay. And she can just use these, pick them up, and put them right place. You know, if you can find it, thank you. Apparently need some outfit work. There you go. And that will work a more precision grip. Kind of get her back functional. And to work supination and pronation. Toy box has an accordion. And you just want to thumb in here, right here, and just pull out, supinate, pronate to bring it back in. And use your fingers, work that a little bit functionally. You do a lot of keyboarding, so you get to make music. Want to give that a shot?
Sure.
All right. Remember to pull in your core when you're playing the accordion.
Of course.
Hard work. It's pretty hard, isn't it? All right.